First responders in the military face a lot of challenges, PTSD being one of the biggest. But might you have been a first responder even though it wasn't your job?
Lose all your Red Cross markings. Nips put a premium on shooting medics. The white's a bullseye.
Welcome back to the channel, folks. Dr. Sharma here, physician, board-certified psychiatrist, and Air Force veteran. This is a highly requested topic, and we're jumping right in. First responders in the military and their struggles. But one thing we have to address right off the bat is who can be a first responder in the military? The answer is everyone. Those of you guys who are veterans know exactly what I mean. With combat lifesaver training, deployment training, each one of us was trained to be able to provide basic first aid, tie a tourniquet, stop the bleeding, do CPR, things like that. And in certain situations, even though your MOS might have been something like infantry or IT, you could still be activated to do some type of medical care.
Are you in or are you out?
What are you talking? In or out of what?
No time for questions, just action. In or out.
Okay, well then I'm out.
I'm sorry, Jet. Actually, you're already in.
Okay, then why would you ask me?
Because I thought you would go, I'm in, Bob, and we would have had a really cool moment.
Now, I'm not saying you have to break out the scalpel and start cutting, but for instance, when you're at your home base, there might be a mass casualty event, an accident on base, overturned vehicle, something where basically if you're nearby, you have to rush to the scene and do your best to help. This might be transporting a patient, doing chest compressions, pulling someone out of a vehicle, holding pressure over a wound, and when you're deployed, obviously there can be many situations where you're activated. Indirect fire, direct fire, IEDs, injured service members coming back to base where there are a lot of injuries and you have to help out, or maybe injured civilians from the country where you are deployed coming back to base, and you have to help stabilize them. This is especially significant since civilians often had the same types of injuries as service members who were deployed. I say all this to say this is something we have to think about. It's true that people who have a first responder MOS, like firefighters, law enforcement, medics, corpsmen, IDMTs, doctors, they are exposed to these stressors, but so can other people who you might not immediately think would have been first responders. For instance, in the Air Force, the chaplain's office was often responsible for collecting human remains, which is absolutely a significant stressor and something you might not have thought about right off the bat. And sure, some people do this kind of stuff and it doesn't affect them. But for others, this can be something that keeps coming back in their mind over and over again. Now, if you had a first responder MOS, it's even more significant because these are things that you were exposed to on a regular basis. I've evaluated so many veterans with these types of stressors, working on wounded fellow service members while deployed, needing to stabilize small children, and women coming to the base who were injured in an attack. And remember, as a first responder, that is something that you might have been exposed to over and over again. And keep in mind, I always talk about the amygdala. That is the fight or flight center in the brain. As humans, we aren't meant to have our amygdala active all the time. So yeah, in civilian life, we might see an accident on the side of the road where we have to stop, but this might be once in many years. We might have to do CPR on someone once in a blue moon, and the amygdala activates. But when you're exposed to these scenes over and over again as a first responder, the amygdala starts to think, hey, John is always working on wounded people, dying people. I need to keep him on edge and ready all the time because this could happen to more people around him, or it could happen to him. So John comes back to the States or leaves the military, and all of a sudden, he can't stop thinking about these things he saw in theater or on base. And yes, I said on base. We always think about deployment, but remember, even in the States, this type of stressor can happen. For instance, there's a training called Sea Stars, where you have to work in a shock trauma center here in Baltimore, Maryland, when you're still on active duty. And you'll see things that are just as gruesome as injuries in Iraq or Afghanistan. Back to John. He's back home now, and he feels on edge all the time. He has recurrent intrusive memories of the things he saw, maybe even flashbacks where he feels like he is back in that environment. These memories might even come into his dreams and create these kind of nightmare scenarios where he feels powerless, or maybe there is some other threat coming towards him, or he can't save someone. This fight or flight center being on edge can also manifest as panic attacks with increased heart rate, shortness of breath, sweating, and over time, John will try to avoid places that bring back these memories. Even walking into a place with sick or injured people might be too difficult. He might have trouble going to medical appointments, going to crowded places that remind him of where he was. He might have trouble with focus, concentration, and maybe even some memory issues. John might have trouble sleeping because of his excessive worrying. Now, there are a lot more symptoms, but those are just some of the signs of PTSD in this context. Not everyone will have all of these symptoms, of course. As with anything I discuss, I always look at the studies and evidence. Something we see over and over again is that the rate of PTSD after mass casualty events and disasters is very high, with rates ranging between 20% and 44%, which is very high, certainly much higher than the general population. In particular, what really seems to lead to the stress and PTSD is exposure to dead bodies and remains, which makes sense, right? The particular features like the damage to the bodies being of children, smells of burning hair, that feeling that, oh yeah, this could be me or this could be someone in my family. This one I've heard about a lot from veterans, seeing injured or dead Iraqi children or Afghan children, then seeing those faces in their own children when they're back home. We can even think about it like empathy, right? And having empathy for that victim, being able to put yourself in their shoes. It's a good thing when it comes to being a human, but sometimes it can stay with you and cause issues. Now, when it comes to this as a stressor, I wanted to mention something specifically. I don't think people in the Coast Guard are talked about a lot when it comes to this. I've evaluated many Coast Guardsmen who have had to witness some really gruesome things when it comes to rescuing injured and dead people in the water, especially based on how long they've been in the water. It's a lot. I think automatically we tend to think about the desert or Afghanistan, like IEDs, mortars, and all of that is true and leads to PTSD, seeing those types of injuries. But let's not forget the rescues in the water either. Going back to the studies, first responders have a rate of PTSD that's much higher than the general population, even outside of disasters, attacks, or accidents, just the job of being a first responder. The risk of re-traumatization is high because, like I mentioned before, if you do that kind of work, it just keeps coming back up. As expected, first responder PTSD comes with a lot of things we see in regular PTSD, which includes irritability, anger, hypervigilance, tension in their personal relationships, and at work. It all comes back to social and occupational impairment at the end of the day. Overall, this topic is really relevant also because of the state of the world. We look at the wars being waged around the world, the need for first responders at these locations. We look at the mass shootings that happen in our country, the terrorist attacks. There are a lot of reasons to keep thinking about the topic of PTSD and first responders because it's going to continue to be an issue, unfortunately, both in the context of the military, but also in the civilian world. Bringing it to the realm of VA disability, if you are a first responder in the military in terms of your MOS, or maybe you had to become one on the fly, you know what potential stressors you have in your history now. So if you have the symptoms I discussed before, you can try to look at your history and figure out what might have been the cause to feel the way that you're feeling right now. Then you can get assessed so you can feel better and have improvement in your quality of life. When it comes to evidence for claims, of course, if your MOS was a first responder type, that is evidence in itself. And remember, there are a lot, right? Medics, combat medics, nurses, doctors, mortuary affairs, corpsmen, IDMTs, firefighters, MPs or security forces, the list goes on. If you have a humanitarian service medal, like maybe you helped pull people and bodies out of the rubble in Haiti after the earthquake, maybe an achievement medal where in the description it talks about how you responded to an overturned vehicle with a victim inside, or maybe you have an EPR, OPR, or some other evaluation describing your actions in an attack or a disaster. There's also your own personal statement describing what happened, in addition to buddy statements from people you served with who were there with you during these events or who discussed the events with you back then. Let's not forget medical evidence. This could be seeing your primary care doctor about the PTSD or mental health symptoms, getting evaluated by a psychiatrist who documents your stressors and diagnosis, going to a therapist who assesses you. That all, of course, adds to the picture for the VA disability claim. Remember, at the end of the day, if any of this resonates with you, reach out for help. Go and get seen by your primary care doc, get a referral to a therapist, psychiatrist, start investigating and figuring out why you're having these difficulties. I mean this when I say it, it's worth it in the end. That's it for today's video. I hope this was helpful for you guys to take a deeper look at how PTSD can come about in first responders in the military and how anybody in the military can become a first responder on the fly. If you found this helpful, please like, comment, and subscribe to my channel. It really helps and it tells me that I'm doing something right. Also, please drop a comment below about your thoughts on the topic, and if you have requests on what to cover in the future, I'd be happy to make a video on it. As always, thanks for watching. Dr. Sharma signing off. See you next time.